The Q-Switch laser does more than one thing. We're able to remove tattoos and we're able to remove brown spots. Brown spots are associated with age, so anytime we get rid of a brown spot, we've given you a new look. Tattoos are emotional. Sometimes people get them and regret them. We're able to help them with this.
My daughter is coming here for facials, and I decided to come, and I've been very happy with her work. And then I was asked if I wanted to remove a tattoo, and I've been wanting to, and I jumped for it. And I was very pleased for the first time because I didn't expect for it to almost be gone at the first treatment because they said it was going to take time. It kind of like disappeared the first time. So I was very happy.
Fortunately, they don't complain of pain. We always use cold air when we're using the laser, and it does make a popping noise, but they really don't feel the pain.
As a grandma, grandkids ask me, they look at me and I try to hide it and all the time, and it's very, and like my grandkids said, if you knew it wasn't going to come off, why did you put it on? I was kind of scared to come at first. Like I said, I expected the worst, with the first noise the machine made, it just made me jump up. But I didn't really feel the pain that I expected. The skin didn't look like it was going to fall off like in the other commercials. I said, what can I do, to go outside? Can I go outside? I just didn't know. Just put some sunscreen on, and that's what I did.
The Q-Switch laser can help anyone. It doesn't matter what your is. It does matter if you have a brown spot you want gone. Tattoos, that's always been a problem. Some people have color, some people don't. We're able to help people with color or with black, and we always want to take a look and give you a realistic idea of what to expect.
It's been a long time that I've been wanting to get rid of them.
As the population ages, looking young and healthy is a booming market, and youth-conscious consumers are seeking a more scientific approach to erase the signs of aging.
As our skin slows down, it begins to get thinner, and some of the problems that we have that are aging related are due to the fact that tissue paper crinkles more than cardboard. So as our skin gets thinner, we start to wrinkle more easily. So if you can use products on the skin that'll turn over the cells faster, stimulate new tissue growth, and make it plumper, you can definitely have some reduction in fine lines, and the skin just looks healthier.
Now, Skin Medica is launching the TNS Regeneration System, a very scientific method that has dermatologists and patients seeing a new world of possibilities.
The newest addition to the anti-aging phenomena is the addition of TNS. This new addition has really expanded our ability to deal with a person who is concerned about anti-aging.
TNS, which stands for Tissue Nutrient Solution, is applied like a simple moisturizer, but it's actually a very scientific product that's produced in a lab.
The whole concept of being able to grow skin in a laboratory sounds very sci-fi, but if you really look at what TNS is, it's a byproduct of a company that grows skin, that's used for patients who have wounds and need skin.
TNS is the only product in the world that has an unparalleled combination of growth factors, soluble collagens, matrix proteins, and antioxidants that are found naturally in healthy young skin.
The interesting thing about the growth factors is that these are naturally occurring substances that we already have in the skin. And as we age, they don't work as well, we don't have as many of them. So if we replenish them, if we bring them back to the skin and somehow allow them to improve the cell function again, to go back to the way they were when we were younger, it makes a big difference.
Unlike many products on the market, TNS has been tested in clinical trials and has clinical data on hundreds of patients across all skin types. More important than the data is how the patient feels.
I've been using the TNS product for about 3 months, and my skin has never looked or felt better.
Do we have to resign ourselves to the ravages of time? Doctors don't think so, and they're working to create products that make aging skin look younger.
came to see me about 5 or 6 years ago as a patient, and she had some issues, like most people living in Southern California, with sun damage from having spent a lot of time outside. And she also had a very dry, sort of fragile skin type. So as she's getting older, like all the rest of us, she didn't have the same options as a lot of other people of being able to use products like Retin-A and things like that that are irritating. And after I'd seen her, we got her started on some SkinMedica products, some TNS, and she had a spectacular response over the last few years to being on that.
A few years ago, I went to my dermatologist, Dr. Rubin, because I was so sun damaged. I was brought up in Southern California, surfing, sailing. Every year my nose was peeling, I was constantly burned, and I'm paying for it now. So a few years ago, I think it was about 3 years ago, Dr. Rubin told me about TNS, and I've been using it faithfully, and I'm really happy with it.
I gave Bo TNS because, number one, it's a great product as an anti-aging, anti-sun damage one. I'm a very strong advocate of the concept of using topical growth factors to treat aging skin, but also because it's a product that's very well tolerated. And even in patients who have reactive or sensitive skin types, since there are no acids in this, normally patients don't have any difficulty with it. And she was the perfect skin type to be able to tolerate that product.
Well, I think I know what TNS has done for my skin, but I'm not a scientist, so I know that there is real science behind it. I just know that I feel my discoloration is better, my broken capillaries, my skin texture seems much finer, and all of a sudden I don't have to wear makeup.
Usually for most people who start on any type of topical product, it's 3 or 4 weeks before something starts to happen. I think patients who have a thinner skin like Bo oftentimes respond even faster, and certainly within a couple of weeks she had some positive changes, and I know that she said within a few months she had people who made comments to her about her skin.
I would advise anyone to talk to a dermatologist, a professional. They know the real science behind the raw ingredients in the products, and then you just try them and see for yourself what works for you. And you may think
Elite Med Spa in Frisco offers a body sculpting technique called Cool Lipo. It liquefies fat and tightens skin from the inside out.
The day afterward, I felt great. I was able to drive, and I didn't have any discomfort at all, and I was like really surprised because I thought it's going to be like, ooh, and it was just what she said it would be. And then the results, fantastic.
Elite Med Spa is one of the first in Texas to offer a new procedure called Cool Lipo. Dr. Sheila Calderon, owner of Elite Med Spa, has been practicing for more than 25 years.
Cool Lipo is laser-assisted lipolysis, and what that really means is we're able to go in whatever area is a problem for the patient. It can be the tummy, it can be the saddlebags. We go in and numb up the whole area, and we use a needle, so it's a small hole. We go back in that same hole, and the laser is smaller than the needle, so it fits through the hole quite easily, and we're able to liquefy the fat. Afterwards, we go in with the liposuction cannula, we turn on the liposuction machine and suck out the liquefied fat. So we're not traumatizing the person by breaking down the fat cells.
Before I had the procedure done, I would go into a department store looking for clothing, and I would always try to find something that would hide my flaws. I wanted to find something that camouflaged my areas, my hips, that little pooch in my belly. And I would end up buying pants that were a size too large, and it would take me hours to find one pair of pants that I was pleased with. I can go into a store now. I don't have to look for that kind of stuff anymore. I can pick anything fashionable. I can pick things that are young, and I can take them in that dressing room, and when I put them on, I am thrilled.
Another great advantage of Cool Lipo is a quick recovery.
Most of them do go back to work the next day or whenever they're ready to, whereas with general liposuction, they really do have a lot of pain, and that's not conducive to having fun afterwards. And we really have people up and about and doing their thing within 24 hours.
I actually had my abdomen done, and it was absolutely unbelievable. Everything went just as Dr. Calderon said it would. No pain. I had it done on Monday and went back to work on Tuesday. So it was great.
Cool lipo is a permanent procedure. The fat is taken out of the body, it's put in a canister, it's gone, no more. So if you gain weight, 20 pounds or more, it goes somewhere else, not to the area you just had the fat removed from. Patients have really loved Cool Lipo. We have addressed their specific issues and we've gotten great results, and they feel so much better in their clothes and out of their clothes.
For the first time this coming summer, after 10 years of hiding my body under little bathing suits with skirts and shorts, I can wear a bikini again.
Introducing Radiesse, the dermal filler that delivers long-lasting, safe, natural results along with the rejuvenated look you desire. You want to look like you, well-rested after a great night's sleep or a long vacation. You, 10 years younger. You want a facial rejuvenation that lets you look better and feel radiant. There are many filler products available today, so you might be wondering what's right for you. Over the next few minutes, we'll discuss the facts and benefits behind this groundbreaking technology. We'll also talk with some Radiesse patients to hear firsthand about their Radiesse stories. So what is Radiesse? Simply put, Radiesse is a natural look that lasts. But I know what you're thinking. Is it safe? Radiesse works with your body to provide a natural-looking result. With Radiesse, you get safe, clinically tested, and FDA-approved reliability. Years of rigorous clinical testing and independent research have shown that Radiesse can be used safely to fill in correct smile lines, nasolabial folds, and wrinkles around the nose and mouth. The secret to the natural result of Radiesse is that it's made of a unique calcium-based microsphere technology that works with your body to replace the volume you've lost, whether it's volume loss in the form of lines and wrinkles or something more substantial. So what is Radiesse and how does it work? Radiesse is made of tiny, smooth, calcium-based microspheres suspended in a water-based gel. Upon injection, the gel and microspheres fill the area, filling deep lines or wrinkles, including those lines around your nose and mouth, commonly called nasolabial folds or marionette lines. You will be supremely satisfied with the immediate cosmetic correction that this minimally invasive treatment provides. Radiesse continues to deliver results as it works with your body to stimulate collagen growth and regenerate tissue to naturally fill in correct lines and wrinkles. The microspheres literally act as a scaffold, allowing new collagen to infiltrate in and around the injection area. Over time, the gel is gradually absorbed by your body. Then the microspheres are broken down into basic calcium and phosphate ions, which are naturally absorbed, leaving your own collagen and tissue in their place. So a question that comes to my mind is, what is a treatment like? It's a simple, quick procedure that can be performed over your lunch hour. The great news is you'll see the effects of Radiesse immediately. Your physician will talk to you about appropriate treatments, anesthetic, and what to expect. Now that we've talked about what Radiesse is and how it works, let's talk to some real patients and hear their Radiesse stories. So you're graduating from nursing school, and then what's next?
First a vacation in Costa Rica and with my husband, and then I will be trying to figure out what exactly I'm going to be doing next with my career.
And your husband, you two have been together
10 years next month.
Wow.
Yeah, 10 years.
Wow.
Married a good guy.
Yeah, that always helps, doesn't it?
Yes, it does.
So tell me about your Radiesse experience.
Well, I was doing some filming for work, and I thought, you know, a lot of people are going to see this, so I wanted to look good for the filming. So I decided to go back and get it done again, and then here I am today. So that was back in 2003.
So what do you remember about it?
I remember that I had collagen done one time before, and it sort of went away after 3 months. And so when I went back to Stanford, they said that there was some new product out there to try. And so I said, what is it called? And I said, Radiesse. And I said, okay, let's try it. And so they tried it with me.
And what did you find?
I found that it worked. And after 3 months, it still worked. After a year, it was still working. So I really liked it.
Tell me about the procedure itself.
Well, how I did the procedure is I know that they do numbers before the procedure takes place. I decided not to do the numbers. I found that I didn't doing the radius without the numbers was fine with me. So they injected me without them, and I went through the treatment fine. And it takes pretty quick. It takes about 15 minutes, 15 to 20 minutes, and it's tolerable, and it's great.
Did the result take a while to see?
No, it was some slight swelling for that night and the next night. And at first I was like, oh no, is it going to go down? Oh, it went down after 2 nights, and then it looked great. I mean, I didn't have the lines I had before on my lower half of my face, so I always felt like the lower half of my face was aging a little bit more than the upper half of my face, so it produced the desired effect that I was looking for.
Did people make any comments? Did you have people that noticed, or?
No, I don't think people noticed that much. I think it was something that I felt that I noticed, and I think that's the most important thing, is that I felt beautiful.
From the beaches to the runway, where there are women, there is undoubtedly cellulite.
Cellulite is one of the most distressing cosmetic concerns for women today. It actually affects 85 to 90% of women, and the other 10 to 15% of women think they have cellulite.
The Triactive Laser Dermology procedure is the newest innovation for the treatment of cellulite and toning the upper body, arms, and face. This unique system uses laser diodes and massage to smooth and tighten cellulite and increase microcirculation.
It can also be used pre or post liposuction surgery, and it can also be used on the face for laser photorejuvenation.
The Triactive procedure is designed to reduce the appearance of cellulite and tighten the tissue through the combined action of deep massage and laser stimulation.
Finally, Triactive has enabled me to feel like I can look in the mirror and feel like I am in shape. I'm going to put that bikini on this summer and go out on the beach. I won't have to wear shorts or sarong.
What's also unique about the Triactive system is that it's the only laser device that's approved for use by spa professionals and estheticians without physician supervision due to its safety features.
Currently, Triactive Laser Dermology is the only system that we use. The best thing right now for our clients is laser dermology. It's effective, it's not expensive, it's fun. The clients will absolutely love it. The estheticians are having fun, and it's a great revenue booster. Usually, we advise our patients to come twice a week.
Welcome to the Triactive Laser Dermology Treatment Series. The Triactive Laser Dermology System is the first system to incorporate lasers as well as massage. The Triactive is easy to use, but it does require proper technique. The strokes are demonstrated in this video, as well as in our clinical manual and clinical posters. We will use the large Triactive handpiece. This handpiece has 2 distinct inserts, one being the shape of a large oval, while the other is more rectangular in shape. As with the lower body or abdomen and back treatment, we will use the more rectangular insert. The oval insert is used for sensitive areas and in post-liposuction contouring. The complete treatment cycle will require 12 to 16 sessions, each lasting approximately 15 minutes, performed twice weekly. Monthly treatment is recommended to maintain the desired results. We are about to begin the arm treatment. As with all Triactive laser dermology treatments, we will begin with the opening phase, which stimulates the lymph nodes to receive the fluid as it is mobilized during the treatment. Opening phase. For the arm treatment, begin with the client lying on the bed face up or in a supine position. Turn the laser on and set the frequency to 5 Hz and the duty cycle to 50. If the client experiences discomfort, you may need to lower the duty cycle. Use the treatment handpiece with the rectangular chamber, placing it perpendicular to the direction of the movement. Start by opening the supraclavicular lymph nodes by the clavicle. You will want to keep the treatment head parallel to the skin. Beginning on the right side of the chest, make 3 medial to lateral strokes. Continue on the left side of the body, making 3 medial to lateral strokes. Stimulate the axillary lymph nodes beneath the right underarm by doing 3 upward strokes. Then, stimulate the axillary lymph nodes beneath the left arm by doing 3 upward strokes. To begin the arm treatment phase, you will do a medial lateral stroke from the inner to the outer part of the arm, snaking up the arm, starting slightly above the elbow and moving toward the shoulder. Repeat this sequence 3 times. Next, you will do 3 slow longitudinal strokes up the arm, starting from the inner part of the arm and moving outward. Depending on the size of the client's arm, you may have to alter the amount of strokes. Repeat this sequence 3 times. Now move to the left arm. Again, moving medial to lateral with a slight arc inward, snake up the arm from elbow to axilla. Repeat this sequence 3 times. Then do 3 slow longitudinal strokes up the arm with a slight arc inward as you did on the right arm. Repeat this sequence 3 times. Have the client turn over to the prone position, lying face down. Starting slightly above the left elbow, medial to lateral, snake up the arm to the axilla. Repeat this sequence 3 times. Now do 3 slow longitudinal strokes up the arm, medial to lateral. Remember, you may have to do more or less strokes depending on the size of the client's arm. Now, move to the right elbow and begin snaking up the arm, repeating the previous motion from elbow to axilla. Repeat this sequence 3 times. Again, do 3 parallel strokes up the arm. Repeat this sequence 3 times. Once the arm treatment is complete, have the client turn back over to a supine position and proceed to the closing or discharging phase of the lymph nodes. You will repeat the process that was used in the opening phase, but in the reverse order. You will once again use the rectangular chamber on the handpiece. Be sure that the laser is on and the frequency is set at 5 Hz and the duty cycle at 50. Begin now by stimulating the axillary lymph nodes on the right side. Do 3 upward strokes. Now do 3 upward strokes to stimulate the axillary lymph nodes on the left side. For the final phase of the closing, move to the supraclavicular lymph nodes by the clavicle. Beginning on the right side of the chest, make 3 medial to lateral strokes. Welcome to the Triactive Laser Dermology Treatment Series. The Triactive Laser Dermology System is the first system to incorporate lasers as well as massage. The Triactive is easy to use, but it does require proper technique. This presentation will focus on the treatment of the face and neck. The Triactive Laser Dermology System incorporates a handpiece specifically designed for facial and neck treatments. It comes with a variety of tips, each with a unique purpose. The large rectangular gold tip is used to stimulate the lymph nodes and for the draining strokes and lifting the neck and facial tissue, with the exclusion of the forehead. The large rectangular violet tip is used for toning strokes of the neck and face and for the final relaxation phase of the neckline. The rectangular red tip can be used instead of the rectangular violet tip when a more delicate procedure is required. The round gold tip is used for the draining strokes and massaging or lifting the tissue on the forehead. The round red and violet tips are only used for strokes on the face as an alternative to the rectangular red and violet tips when a more delicate operation is required, or where the use of the rectangular tips are particularly difficult due to the size of the area being treated or the contour of the area. We are about to begin the face and neck treatment. As with all Triactive laser dermology procedures, we will begin with the opening phase, which stimulates the lymph nodes to receive the fluid as it is mobilized during the treatment. For the face and neck, treatment begins with the client lying on the bed in a supine position. Make sure the laser is off when treating the neck area. You do not want to affect the thyroid. Set the frequency to 5 Hz and the duty cycle to 50, and remember, the laser is off. You may need to lower the duty cycle setting to 20 if the client experiences discomfort. Using the treatment handpiece with the rectangular gold tip, open the supraclavicular lymph nodes in the neck. Beginning on the right side of the neck, moving toward the shoulder, do 3 medial lateral strokes. Next, do 3 descending strokes from behind the earlobe down to the clavicle area, being careful to avoid the carotid artery. We will now repeat the procedure on the left side. It may be easier to treat this side of the face and neck with your opposite hand so that the cord of the handpiece does not lay over the client's face. Starting on the right side, you will treat the area from beneath the center of the chin to the ear. Perform about 6 linear parallel strokes, moving medial to lateral, from jawline to the clavicle. The number of strokes may vary based on the size of the area being treated. Repeat this sequence 3 times. Seeing the skin jiggle is confirmation that you are doing the stroke correctly. For the next sequence of treatment, turn the laser on. The frequency and the duty cycle are already set at 5 Hz and 50 duty cycle respectively. Even though the Triactive laser dermology does not require ocular protection, you should always have the clients close their eyes when you are working on the face area. Start underneath the lower lip, moving toward the chin. Continue placing parallel strokes up the face, ending right below the temple. These strokes will fan out and up. For treating the forehead, keep the system settings the same, but switch from the rectangular gold tip to the round gold tip. Following the curve of the forehead, move across the forehead over the eyebrow to the temple. Repeating the sequence 3 times. On the final stroke, you can continue moving all the way down to the cheek. We are now going to begin the lifting or toning phase of the neck and face. Remember, you must turn the laser off when treating the neck. Change the system settings to a frequency of 1 Hz and 40 duty cycle for an intermittent suction. Using the rectangular gold tip or the round gold tip in short staccato strokes, move across the neck in ascending rows toward the ear. You can see how this setting lifts the skin. Now, treat from the neck moving up and out toward the ear. Repeat this sequence 3 times. Turn the laser back on while maintaining the previous settings of 1 Hz, 40 duty cycle. Starting at the chin, moving toward the hairline, place short strokes up the face, avoiding the eye area, and ending at the temple. Welcome to the Triactive Laser Dermology Treatment Series. This presentation will focus on the treatment of the back and the abdomen. This treatment can also be used for therapeutic massage as well as post-liposuction. The Triactive Laser Dermology System is the first system to incorporate lasers as well as massage. The Triactive is easy to use, but it does require proper technique. The strokes are demonstrated in this video as well as in our clinical manual and clinical posters. We will use the large Triactive handpiece. This handpiece has 2 distinct inserts, one being the shape of a large oval while the other is more rectangular in shape. As with the lower body or arm treatment, we will use the more rectangular insert. The oval insert is used for sensitive areas and in post-liposuction contouring. The complete treatment cycle will require 12 to 16 sessions, each lasting approximately 30 minutes, performed twice weekly. Monthly treatment is recommended to maintain the desired results. We are about to begin the abdomen and back treatments. As with all Triactive laser dermology treatments, we will begin with the opening phase, which stimulates the lymph nodes to receive the fluid as it is mobilized during the treatment. Opening phase. For the abdomen and back treatments, begin with the patient lying on the bed in a supine position, facing up. Turn the laser on and set the frequency to 5 Hz and the duty cycle to 50. If the client experiences discomfort, you may need to lower the duty cycle. Using the treatment handpiece with the rectangular chamber, place it perpendicular to the direction of the movement. Open the supraclavicular lymph nodes by the clavicle. You will want to keep the treatment head parallel to the skin. Beginning on the right side of the chest, make 3 medial to lateral strokes. Continue on the left side of the body, making 3 medial to lateral strokes. Stimulate the axillary lymph nodes beneath the right underarm by doing 3 upward strokes. Then, stimulate the axillary lymph nodes beneath the left arm by doing 3 upward strokes. Next, you begin below the sternum or the subxiphoid area. Stimulate this area with 3 small circular motions. You will stimulate the inguinal lymph nodes in the groin area. Keeping the treatment head parallel, do 3 medial to lateral strokes on the right side. Then, repeat the 3 medial to lateral strokes on the left side. Next, you will perform the visceral phase, which will stimulate the abdominal area. Massage the area in a square-like sequence, essentially following the flow of the large intestine. Starting from the right iliac fossa, ascend toward the stomach, then transverse across the abdomen, descending down, and transverse across the bladder to complete the stroke. The skin should be jiggling, but remember not to apply too much pressure to the abdominal area. Repeat this sequence 3 times, with the final stroke ending on a downward motion in the middle of the pelvis. To begin the abdominal treatment phase, you will start on the right side of the body. Moving from the center of the abdomen, arching towards the rib cage, from midline to the side. Perform a series of parallel strokes to cover the area, repeating each consecutive sequence 3 times. Then, starting to the right of the belly button, move down towards the junction of the pelvis and thigh area. Do 3 or 4 short strokes. Repeat this sequence 3 times. Next, you start on the right mid-thigh, moving towards the inguinal area, or the thigh-pelvic junction. You will do about 5 upward strokes placed parallel to each other. Again, the number of strokes may vary based on the area being treated. Welcome to the Triactive Laser Dermology Treatment Series. The Triactive Laser Dermology System is the first system to incorporate lasers as well as massage. The Triactive is easy to use, but it does require proper technique. The strokes are demonstrated in this video, as well as in our clinical manual and clinical posters. We will use the large Triactive handpiece. This handpiece has 2 distinct inserts, one being the shape of a large oval, while the other is more rectangular in shape. We will use the more rectangular insert. The oval insert is used for sensitive areas and in post-liposuction contouring. The complete treatment cycle will require 12 to 16 sessions, each lasting approximately 30 minutes, performed twice weekly. Monthly treatment is recommended to maintain the desired results. We are about to begin the lower body treatment protocol, specifically for the treatment of cellulite, which can also be used for post-liposuction contouring and for therapeutic massage. As with all Triactive laser dermology procedures, we will begin with the opening phase, which stimulates the lymph nodes to receive the fluid as it is mobilized during the treatment. Opening phase. For the lower body treatment, begin with the patient lying on the bed in a supine position. Turn the laser on and set the frequency to 5 Hz and the duty cycle to 50. If the client experiences discomfort, you may need to lower the duty cycle. Using the treatment handpiece with the rectangular chamber, open the supraclavicular lymph nodes by the clavicle. You will want to keep the treatment head parallel to the skin. Beginning on the right side of the chest, make 3 medial to lateral strokes. Continue on the left side of the body, making 3 medial to lateral strokes. Next, you will move to 2 inches below the tip of the xiphoid, right above the stomach. Stimulate this area with 3 small circular motions. You will stimulate the inguinal lymph nodes in the groin area. Keeping the treatment head parallel, do 3 medial to lateral strokes on the right side. Then repeat the 3 medial to lateral strokes on the left side. Next, you will perform the visceral phase, which will stimulate the abdominal area. Massage the area in a square-like sequence, essentially following the flow of the large intestine. Starting from the right iliac fossa, ascend upwards toward the stomach, then transverse across the abdomen, descending down and transverse across the bladder to complete the stroke. The skin should be jiggling, but remember not to apply too much pressure to the abdominal area. Repeat this sequence 3 times, with the final stroke ending on a downward motion in the middle of the pelvis. Treating the front legs. To begin the lower body treatment, make sure the laser is on and the system is set at a frequency of 5 Hz and 50 duty cycle. Begin above the knee of the right leg, moving medial to lateral. Take the handpiece through a snaking motion up the leg to the inguinal area, or where the thigh and pelvis meet. You should see the skin jiggling. Don't worry about reaching around the entire front of the leg, because you will be able to easily access the rest of the leg when the patient is lying prone or face down. It is extremely helpful to use a stool or chair on wheels in order to easily navigate this part of the body. Repeat the snaking sequence 3 times. The next phase will begin from the inside of the knee, moving in slow longitudinal strokes up the leg to the inguinal area. Be careful not to go too close to the patella. You will continue the longitudinal strokes ascending up the leg, medial to lateral. The first and second strokes will turn in towards the lymph nodes, almost like you are tracing the shape of a pumpkin. The third stroke will ascend up the leg in a straight line, and the fourth and fifth strokes will also turn inwards towards the lymph nodes in the pumpkin motion. We will now treat the left leg. Beginning just above the left knee with medial to lateral strokes, snake up the leg towards the groin area. Repeat this sequence 3 times. Begin the next phase from inside of the